everybody, it's Jerry. Thanks for jumping in. I'm so excited to be here with veterinarian Christine Bridges. Christine has a veterinary practice in West Virginia, and she's going to be telling us about her veterinary practice, but also about her experience using carbon dioxide therapy on some of her horse patients. Hey, Christine.
Hello.
How are you?
I'm fine, thank you. Thank you for having me.
To get started, you tell us about your veterinary practice.
Well, I own an ambulatory practice in the tri-state area of Virginia, Maryland, and West Virginia. And I see primarily medicine cases, and I've been doing this for over 25 years.
So, I read a couple of case studies that you wrote about Penny and Rocket. And maybe that's a good way to start out, because really, as a horse owner, it's so important to know about safe, effective practices that are out there and methods for therapy that are out there for our horses.
Definitely.
And I'd love to have you explain to us what's important about CO2, what should we know, but also a little bit about these two cases, Penny and Rocket, what your experience was, why you even thought about using carbon dioxide as treatments.
Certainly, the carbon dioxide treatment basically works by being absorbed across the skin, and whatever region you're treating, the body automatically responds by increasing blood flow and oxygenation to that area. But also, it causes angiogenesis, which is the development of new blood vessels into that area. So all of those things are really important for tissue healing, cell healing, what we want to do.
What kind of cases then would you use? Well, maybe the question is, how did you first find out about carbon dioxide? And how safe is it? It sounds like it's, different. I hadn't heard of it.
Most people had not heard of it, but the concept is literally thousands of years old. It's very safe, it's very easy to use, and it's incredible the results that we're seeing. So one of my very first cases was Penny, and she is a quarter horse who unfortunately stepped on a nail, and she developed a very serious infection involving the navicular bursa, the navicular bone, and the tendon sheath.
Yeah.
So
They step on nails all the time, don't they?
yes, but she was one of the ones that stepped on it in a very, very dangerous area. Yes. So the infection was very serious. We had to refer her to a surgeon. And because of the extent of the infection, her only chance of survival was surgery, but the surgeon informed us that the prognosis was very poor, and he felt that she had less than a 25% chance of survival. But thank God the owner went for the surgery, and when she was discharged, we immediately started the CO2 therapy. And she was one of my very first cases using the therapy. And it was amazing what we saw even within the first week. She received about 15 treatments over about a 3-week period. And within the first week, we saw a reduction in inflammation and pain. When she came home, she was not wanting to bear weight on that limb. And the amount of pain reduction and the amount of reduction in inflammation was very, very impressive.
What a relief for the owners and for you.
Yes.
So how did this all happen in terms of the treatment? You're working with the surgeon. You're working with the owner. What was the owner's reaction to the therapy and what you were doing and Penny's chances of surviving this?
She was desperate. She loved this horse so much. She wanted to do whatever it took to help the horse. And so the surgery itself went well. But sometimes you can do your best and things fall apart. So the combination of the surgery and the antibiotics and the CO2, she is 100% sound today.
Oh, that's fantastic. What a great story. And the second case study that I read that you wrote was about Rocket.
Yes, Rocket is a miniature horse, and like many minis and ponies, he developed metabolic laminitis, and no matter what we tried, we couldn't get him comfortable. And so we were at a point, having to make a decision of his comfort level and quality of life. And he is one of my first laminitis cases that I used the CO2 therapy. And I was very impressed with the pain response, because that's what we want first. We want to relieve their pain. But the CO2 therapy is just such a wonderful therapy for laminitis, because there's so many aspects of laminitis that you need to address. And the CO2 therapy addresses all of them. So it is, you get the increased blood flow, increased oxygenation, the angiogenesis, where they develop new blood vessels to infiltrate the area. You also get a decrease in inflammation in the lamina of the feet. That's very important. Something that's very exciting with the CO2 therapy is we have seen significant sole depth growth, which is huge, because we have a lot of cases of laminitis that we're doing everything we can, but we can't get them to grow any sole. So this has been very, very exciting to see the amount of healthy sole tissue that we get from this treatment. It's wonderful.
And it sounds like Rocket's doing well today.
Yes, he's had, his ups and downs because he is a metabolic case. So the CO2 therapy alone for, acute laminitis may be enough, but with the metabolic cases, everything has to be managed perfectly. So we're still, working on that and making some changes, but his hooves look like entirely different hooves than when we started. So that
Congratulations.
Yes.
That's really great.
Thank you.
When you were doing the therapy on Rocket and Penny, and probably other horses you've worked with, how do you work with the owner? How does the owner do part of the therapy? Do you come to do they bring their horse to the barn? How is all that
Typically,
work?
I travel to the farm initially and show the clients how to use the treatment. And it's so easy. Everybody's been very comfortable using it. So I can come out one or two times, and then the owners take over. And then for follow-up appointments, I'll come out and we can do the treatments together. But haven't had any issues with anybody having problems doing the treatments. And the horses, they respond very well.
Well, that's what I was wondering. These are horses they've been in pain. Obviously, Penny had a really serious wound.
Yes, and of course that was her rear leg, and she was a little bit nervous. But after the first treatment, when she realized that it actually felt good after the treatment, no problems at all. So we've had some cases where we have to sedate the first treatment just because they're nervous with putting the bag on, or maybe filling the CO2, but haven't had a single case that we have had to sedate from the second treatment on. So it's pretty good.
Some horse owners have to sedate just for shoeing purposes.
Exactly.
So it seems like in these cases that are so serious,
yes,
that really wouldn't be a big factor in the treatment.
No, in fact, some of the cases it's very nice to see where they drop their head, they relax, they start licking their lips, and you can tell that they're getting some relief. So it's wonderful.
That's great. So this sounds like it's a safe therapy.
Definitely.
And
it's non-invasive. It's easy to use. It's the tool that I grab from my truck. I can honestly say that I see cases every day that could use this. This is what we do. We want to heal tissue, whether it's an infection, an injury, laminitis. The cases are endless.
Yeah.
How we can use this.
Well, I feel a little bit teary-eyed thinking about this, because we all, as horse owners, look for remedies. We look for therapies that will help our horses. In some cases are so seriously desperate, which are some that, of course, you probably see.
Exactly. And I can think back to cases where I wish I had this therapy, because I knew it would have made a difference. So,
Well, congratulations. It's so wonderful to have this conversation with you. I hope you'll come back again. And
Of
I'm
course
sure
I
we can
will.
talk about other things, but
definitely.
Thanks everybody for hopping in and learning about Christine's experience using carbon dioxide therapy for your